Hey guys, it's Dr. Al. Thanks for checking out our explanation video here. Either I've explained this to you in the clinic or you have just found our handouts on the app and are just checking it out. But this is our handout about what a good ADHD assessment should look like. Right now on the app, the handout is called the ADHD Assessment Components Brief, and I promise that I'll keep it brief. Historically, ADHD has been one of the most overdiagnosed kid disorders. That means a lot of kids get the diagnosis that don't have it, and part of the reason that happens is because they don't go through a good assessment. Also, to be honest with you, out there in life, everyone thinks they're an expert on ADHD, and ADHD is kind of hard to assess. So you want to make sure you know what you're doing and follow a good assessment process. We call it a multimodal multi-agent. What that means in English is you ask the question a couple of different ways of different sources to try to find out if you think the child has ADHD. So basically, when I do an ADHD eval, it's like trying to build a table with three legs. We get parent report, we get report from parent report or report from whoever's raising the kid, teacher report, and then testing data that's more what we call objective. So it's kind of like building a table with three legs. So parts of a good assessment, well, like it says on the handout, the best way to make sure that your child is not misdiagnosed is to make sure that that kid has good assessment. If you follow just this little handout or when you're interviewing providers, to include me, make sure that they're going to do this with your child. So first is a clinical interview. Should interview parents or whoever's raising the child. Parents tend to be experts on their own kids. You guys know more about your kids than teachers do, family practice docs do, than I will, because you see your child in every circumstance, in every setting. Also should interview the child. You don't want to over-rely on child report, because when you look at the scientific literature, it shows that kids are pretty bad reporters of their own behavior. They have a hard time seeing themselves in context, like compared to other people. And then teachers, if possible, teachers tend to be developmental experts. What that means is they see repeating groups of the same age of kids over the course of their career. Then you want to use testing. Normed instruments. We use oftentimes an IQ and an achievement test, just because sometimes kids with ADHD will have a learning disorder or disability, or sometimes kids with a learning disability look like kids with ADHD, and you want to make sure that you're teasing those things out. We also have a sustained attention test that we use. The one we happen to use is called the Connors Continuous Performance Test. I refer to it as the world's most boring computer game. What's not on the handout is that we routinely do an objective depression and anxiety measure, both to get a good read on those mood issues with the kids and to make sure that we're not dealing with a mood issue instead of ADHD or in addition to it. And then other objective measures are what we call normed instruments. So we use questionnaires. And what a normed instrument is that we get parent ratings and teacher ratings, and then those scores get compared to a nationwide sample of other kids, the ratings that other kids get, the age of your child, to see if they look typical, better than typical, or worse than typical. And we tend to send those out to parents and to teachers, and sometimes we get them from kids as well. And like I said in the other section, we routinely look for anxiety and depression. So basically, you want to make sure that when you're getting an evaluation that these components are going to be present, and that way we won't make any mistakes, or whoever works with your kid won't. Now, lots of times people will go to a neuropsychology clinic and get a whole bunch of neuropsych testing done. And right now, the literature doesn't really show that increases diagnostic accuracy. However, if you do less than what we're doing, if you just rely on interview or on a doctor's interview or a psychologist interview, your chances of being accurate go down. Just like if you only rely on questionnaires that are filled out or you only rely on testing. You need to put all of that together and consider those things together when you're trying to get a good snapshot of your child. So anyway, I hope this helps. That's an explanation of that handout. This is Dr. Al. Thanks for taking a look at our video.